is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Good morning, everyone. I'm Jackie.
And Coach Patrick.
Guys, thank you for listening to Help Matters podcast, where your help matters.
Another beautiful day, Jackie, the Lord has made.
Hey, we're going to rejoice and be glad in it.
Yes, we're going to do that. Listen, we want you to join us right here every Saturday at 9 a.m. as we bring you relevant information pertaining to your health and well-being. We'll have healthcare professionals and other professionals on the show to assist us in helping you to be the best you that you can be as it pertains to your health and well-being.
All right, guys. So you already know what to do. Head over to Facebook and go like Get Fit with Jackie Fitness on Facebook and click and subscribe to our YouTube channel at Help Matters Jackie and Coach.
All right. Happy birthday to everyone that's celebrating a birthday in this awesome month of January. Happy birthday to my brother-in-law, Tony. Happy
Yes,
birthday
81 years old.
Big 81.
Yes, absolutely.
Wow.
And Deborah McDaniel, our
Deborah
project manager and
McDaniel,
friend, would be turning our pastor
Awesome.
of the church. Yes,
Awesome.
yes.
Awesome.
Happy birthday, happy birthday, and happy
Enjoy.
anniversary.
Yeah.
Anniversary.
Happy anniversary to everyone that's celebrating an anniversary, however you did it. Jump the broom, tied the knot. Listen, you did it. So as you become one, enjoy each other, be friends, love each other, and make memories, okay? So happy anniversary and happy birthday to everybody that's celebrating on this month. To be a sponsor, a partner, a friend of the Health Matters broadcast, you can call 706-592-8862. We would love for you to partner with us to help us bring this podcast to the CSRA community and beyond every Saturday at 9 a.m.
And guys, thank you for always joining us. And guys, we have a special guest in the studio this morning, and we'd like to welcome back our own very Dr. Dan Jolich back to Help Matters.
Hello.
Hey,
How's everybody doing?
everybody. We're doing great. How about you? New
Pretty
year?
good. Yeah, well, Happy New Year. Let's have a good one this year and make it even better than last, hopefully, you know?
Absolutely. Be better
That's the
than what
plan.
we was.
That's
Yes.
the plan.
Yeah.
But you know, with them plans and resolutions that people sometimes make, sometimes they fall short of them.
True.
Well, we thank you so much, Dr. Dan, for being on the show this morning. We're going to talk little bit about, what slip, trips, and falls are. We're going to talk a little bit about cold weather and just people, exercising and how chiropractic care plays a part in those different areas for their life. So again, thank you for being on the show, and you jump right into it, wherever area you want to jump into. Well, I'll tell you, let's start with slips and falls. What are slips, trips?
Well, I just want to mention, talk about in general about, the winter and how to stay healthy in the winter time and, how to prevent injury maybe. But obviously slip and fall that you just, brought up is a very dangerous condition. We got to avoid that at all costs. Of course, living down south, we don't get as much ice and snow as they do in some other states, but it can happen. I mean, I think this coming weekend is supposed to be kind of cold, so we'll see what happens. So, I want to, emphasize that, especially for a viewer audience or, people there maybe senior in age, they got to be really extra careful because when you're walking up and down the stairs, you don't want to be slipping or falling. Some of the people may have bone density issues and osteoporosis, osteopenia, one of those things, and they can cause fractures. So you want to be very careful. Do like one step at a time, 1 foot at a time. Hold on to the railings. If you're not sure, maybe have some kind of an advice, like a cane or something to make sure you don't fall. So just be deliberate in your walking and make sure you don't fall. I don't know if I mentioned this in the past, but my great grandmother, when I that I knew when I was a child, she only had like 3 steps in front of her house, and one day in the wintertime she slipped and fell. And she broke her hip, and that happens a lot, especially to women after menopause, because after menopause the certain hormonal levels plummet. Those are namely estrogen and progesterone, and those things are basically catalysts. Catalysts are molecules that help certain things happen. So catalysts in this case would transfer the molecule calcium from the bloodstream into the bone. So if you don't have those catalysts, you're just not going to get enough calcium in your bones, so become brittle. And the strongest bone in your body is femur, but there is a little narrowing at the femur, at the neck area, and so that's like a weak spot. So that's when most people end up having fractures. So she did that. She fractured her femur. And I just remember her as a child that she was always sitting. She can never really walk really good. And she didn't live much longer after that, because if you don't have mobility, everything else in the body suffers. Your blood flow is not as good, and other things happen. Like I always said before, motion is life. So when you diminish your ability to move, other things are going to happen in the body, and that's kind of what happened to her eventually. And she eventually passed away. So you got to make sure you prevent that. Problem with my great grandmother's staircase, even though there was only 3 steps, there was no railing there. So, she couldn't hold on to anything. I mean, that seems like a simple thing to add, but, she didn't have it. And so, that was one of the reasons why that happened to her. So we got to be very careful.
Let me interject just real quick, because you brought up 2 very, very good, important points. How you talked about seniors falling, and how you talked about women in menopause, and how they,
right,
their body can, their bones can break easily, and especially with seniors, when their bones break, it's hard for them to restore and repair themselves.
Yeah. And go ahead, Dr. Dan.
I was just going to say, they just don't have enough. See, our body doesn't synthesize calcium. We have to ingest calcium in a diet, and as we talked in the past, the diets are just not that good anymore. A lot of our food that we use is depleted off of the minerals and nutrients that we really need. So that's why people sometimes need to consider taking some supplements, and that was one of the other things that I was going to talk about. During winter time, you might have to take some supplements to make sure you don't get low on certain vitamins and minerals that maybe you may not get. So calcium is one of those things that people should consider having as a supplement as we go through aging process, because maybe we don't get enough from it from food, And when we talk about calcium, I want to mention one more thing. There are different forms of calcium, and that's what's misleading sometimes. Certain forms of calcium we can absorb in our body. We have the enzymes to use it, but then certain forms we don't. So, for instance, a long time ago, I was a food scientist before I became, doctor of chiropractic. And I worked in a food industry, and I worked in a facility as an engineer where, they process milk and things of that nature. So, when the milk goes through the processing, it gets polluted. So they have to use pasteurization process to destroy all the bacteria and, viruses that could be in there. So that means they heat it up at a certain temperature for a certain amount of time. And I saw it. I saw in my own eyes how they make it. So, there's all these pipes that heat up like that, and they clogged up because all the good stuff that's in the milk, like calcium, precipitates, and it clogs up those pipes. Yeah, so the worker every so often would literally stop the line and then open up these pipes and scrape off, and it's all white crust, because white is calcium, so it's mostly calcium. And he will scrape all that off, and then turn it back on, and USD inspector was right there with him. So it will literally take him like 10 seconds to do this because they get really good at it. But they have to scrape all that off, and that's all good stuff. So the problem with all that stuff is when the comes the other way, the milk really doesn't have all those nutrients like you would expect, so it doesn't even look like milk. It's not even white. Calcium gives it that whiteness. Yeah, so they reconstitute, they put other stuff back in it, and again, there's another USD inspector there making sure they put enough stuff in there. But it's not the same form of calcium is what I'm getting at. So the milk used to be really good source of calcium.
Yes, it did.
Yeah. When we were all farmers, like my grandparents were farmers, not that long ago. I mean, I guess it depends on your point of view how long ago that was. But if you have access to cows in a farm and you go milk the cow, you can drink that milk right straight from the cow. It's perfectly sterile when it comes out of the cow. You can literally drink it. That's what farmers used to do. That's what everybody used to do back in the day. And then milk is really... Yes, and it's got a ton of calcium and other stuff. So calcium is called calcium lactate that was in the milk, and we can actually digest that, and that will help us as well. But when they do this process of pasteurization, calcium lactate, it's destroyed. So they put another form of calcium in it called calcium carbonate. Now, we do not, as humans, we do not have enzyme to dissolve calcium carbonate. You can Google all that. But calcium carbonate is really, really hard. So, why did they put calcium carbonate back in the milk? Why don't they put calcium lactate? Well, it's the cost. It's the cost of things. It's easier and cheaper to buy calcium carbonate form of calcium. And where does that come from? Eggs. So, I also worked in a factory that made egg products like egg beaters and stuff like that. So what happens with all the eggshells once they, open up the eggs and use it for other products? They used to throw them away, but they don't throw anything away. They take the eggshells, they pulverize them, and they heat them up, and they grind them down into a white powder. It's like a fine powder, and that's now sold as a source of calcium, So that's what they use. It's a lot cheaper. But we do not digest calcium carbonate. So you don't see it because it's in small forms. So you're drinking that milk, you're thinking, oh, I got enough calcium. Well, it's the wrong form of calcium. We don't get a lot out of it. So
Dr.
that's why
Dan,
somebody...
I tell you,
let's open up that a little bit. Go ahead, Jackie.
Yes, we need to let's open it up a little bit. Me too. And what we're going to do. I want you to send that because we're going to put those on our platform, our website. When I put that out, so people can see that because we do tips on our website, and so I want to put that out. Which, of course, with your permission and your name on it, chiropractor, because people need to know that, Dr. Dan, they don't know.
And it's just so good how you brought up about the nutrients in the milk, how they actually take the good stuff out and then replace it with something that we don't even really know what it is and put a name on it.
And it's not digestible for, human form. We can't even digest this stuff.
Yeah, so what happens is, calcium carbonate is also put in a cheaper multivitamin product. So when you go and buy calcium as a form of a pill, as a supplement, you really need to read the label and see what they put in there. If it's calcium carbonate, you're wasting your money. It's just going to go right through your body. There's other forms that are, acceptable, calcium lactate, calcium citrate, and even calcium bicarbonate. Those we can, digest. But calcium carbonate just goes right through. So it's interesting. When I have new patients in my office and they come for, back pain or what have you, and I take an x-ray to see what their, pelvic looks like, sometimes I see little white specks in the pelvic opening on the x-ray. And there's nothing that should be in there. So, when I first saw that over 20 years ago, I was like, what is this? Is this some kind of tumor? And then I found out, no, that's actually undigested pills that a person has taken. So once you see it in the pelvic rim area on the x-ray, that is basically being ready to be discarded from the body. It's going to be, expelled from the body at that point. So, I always point it out to the patient. I see like little white stuff. Just the other day, I had a lady that had a lot of back pain, and I took an x-ray, and I saw like 2 or 3 little specks down there. I said, did you take any pills like for pain or anything for that? It's like, well, I did take Tylenol and I took the supplements and all that. And so why do you ask? How do you know? I said, See those little spots down there on the x-ray? That's your pill that you took. So people think that, when you take a pill, 100% of that pill goes in your body, but it doesn't. If you look it up and you read about it, some of the pills, less than 50% get absorbed in the body. The other half just gets discarded because they're really hard to dissolve. They're really hard to digest, and it depends what's in it. So, if you want to take supplements, you really have to be smarter than that. You have to kind of look into the ingredients list and see what form of certain things are, like calcium that we're talking about right now. And the price is really the same. I mean, if you have a, multivitamin that I see in the store that has calcium, citrate in it, it's about the same price as calcium carbonate. You just need to be smarter than that. So citrate it gets absorbed. Also, this is interesting. If you, I'm not, advocating that we drink juices a lot because that's a lot of sugar. But if somebody drinks orange juice that has calcium added to it, if you look on the label, that orange juice has calcium citrate in it. So technically, the glass of orange juice will give you more calcium than the glass of milk because it's a different form of calcium.
Yeah.
So what is the so the question is, why does the government allow them to use a wrong form of calcium because of the cost and all that? But why do they allow that? Well, they know that nobody will buy milk if public kind of knew what kind of processing that milk went into. So that really what you drink in the store, you buy, regular, gallon of milk. It really should be called milk product because there's so much things that are done to it. But if you call it milk product, no one's going to buy it. So the government allows them to call it milk. But there's like at least 7 different things with the milk you buy in the store that's different than the milk you buy or you can get it from like a cow directly on the farm, which, in this area, you can do that. There's some Amish communities or Mennonites communities around just outside of Aiken that you can go to. They'll sell you like fresh milk, but, it will spoil. You have to drink it right away. You can't, you can't. Right. So, there's all kinds of stuff like that, but we're getting off the subject for that, winter.
But that was
that's good, Dr. Dan. A lot of people don't know that. I'm sitting here looking at Mayo Clinic now, and everything you're saying is confirming that.
Right.
Calcium citrate absorb better.
Right, and we started off talking about slip, trips, and falls, and it's important to build healthy bones.
Yeah,
and
that's the root behind why these falls can happen.
Yeah, and calcium helps us to build those strong bones. I tell you, but a lot of things.
Yeah, since we started about slip and falls and talk about calcium, I was also going to mention some other maybe vitamins and stuff that we need to take or consider taking in the wintertime to make sure we stay healthier. So if I can kind of go into that, I think that will kind of continue on from calcium. Yeah, so I would say one of the vitamins that we tend to lose in the wintertime is vitamin D. Now, vitamin D is not really that horrible to get in. Our body can synthesize vitamin D through the skin while it's exposed to the sun. Now, in the wintertime, a lot of times it's not that sunny, it's cloudy. So you don't get that vitamin D production like you should, number one. So number two, it's also cold. So we tend to have clothes on. We're not going to go outside when it's, 40, 30 degrees with just a T-shirt. So, how much of that is going to go through the skin and get really, synthesized by the body, by the influence of the sun, maybe not as much as it should. So we tend to stay indoors and all that. So, vitamin D in the summertime, it's fine because if you go in the sunshine for just 30, 40 minutes a day, it will give you enough vitamin D for the rest of the day. Your body will make it. So they call that really like a sunshine vitamin, But hey, in the wintertime, that doesn't, do as much. Also, the days are shorter in the wintertime and, we spend more time indoors. So we really need to consider vitamin D because it has a lot of health benefits. It also helps with the bone structure and also improve the resistance against, certain type of diseases. There's also some depression people experience during the winter months, and they say the vitamin D kind of helps fight those winter blues. Unfortunately, there's not a lot of food that contains vitamin D. So some kind of fish And again, back to dairy, if they're fortified with vitamin D, which has other problems, and then mushrooms, some kind of mushrooms have vitamin D, but they're in really small amounts. So you got to kind of read the label if you're buying certain products and see how much of that is percentage of daily value. It might be only like 3%, 5%, 10%, which means you need a lot more than, the serving size in a day to get enough vitamin D. So you got to sometimes consider possibly having some vitamin D supplements. So the vitamin D recommendations have actually changed over the years. And so, you mentioned Mayo Clinic, and I like to look up their stuff as well. So Mayo Clinic says if you get between 600 and 2,000 international units, or IUs is what that's measured in, basically that can be, safe and beneficial. And you don't want to overdo it either, because you can cause some other issues if you have too much vitamin D, in your body. So, you got to read the label. You got to be a little educated about that stuff. But vitamin D is typically something that we lose in the wintertime, and we need to, think about replenishing that.
Let me sneak in here right quick. Now, as you're talking about supplements, right? I know as people take prescribed medications, they doctor have to also check their liver to ensure that there's no damage coming to it from the prescribed medication. Is there any concern?
As well?
Yeah, kidney. Is there any concern for supplements?
Yes. The big concern with medication, so that's a whole new topic, whole new ball of wax, but there is something called medical depletion of nutrients. So what happens is certain medicine that we take, especially the ones for cholesterol and for the heart, heart function. So medicine they prescribe to fight, increased cholesterol and heart problems, can also cause nutrient depletion in our body. Now, there's a lot more to it, but I mean, in general, that's what happens. And the reason why that happened is the chemicals or the compounds that are found in this medicine also attach to themselves, on the molecular level, these vitamins and minerals. And basically, as it goes through the body and gets discarded, actually, we shed those vitamins and minerals more when we take those medicines. So that's another side effect of having, medicine. So they say that medical science says that you will, if you take certain type of medicine, talk to your doctor, you might need to take some other supplements to combat this depletion of nutrients in your body by taking the medicine. So it gets complicated. There's more to it. You have to go per each medicine and kind of see what you need to do. But it's a real thing. My brother-in-law that is a pharmacist. Now he is on the corporate side of he doesn't work in a pharmacy like a pharmacist. He's actually on the corporate side of the business. He's very, very well educated, and he's got an MBA in business and all that. He actually years ago came out with the a company where they were going to sell supplements specifically formulated to combat loss of nutrients if you're on certain type of medicine, especially cholesterol medicine that he was targeting. So, he didn't succeed though, because cost of him doing it is a lot higher than big, companies doing it. So it was very expensive what he was trying to, sell. But the point is there. The point is valid that the, medication causes nutrient depletion out of the body. So what I would say, if I was somebody taking those kind of medicines, I'm not, but if I am, I would talk to my medical provider that prescribed those medicines and kind of address that and say, hey, what do you think I should take to counteract the loss of nutrients by taking this particular medicine that was prescribed, and see what the doctor tells you. Or if they don't really get into that, maybe they can, make an appointment to a, somebody else that does that, like nutritionist or what have you. But that is an absolutely serious thing. Yeah.
Okay.
Yeah. Now, should you go to a chiropractor after a fall? If you have a fall, should you see a chiropractor?
So here's the answer to that. If you get all bruised up, but you don't break a bone, after you feel a little better, yes, we should check you. We should take X-rays. We should make sure that you didn't knock out the spine and get it adjusted. But you have to heal first. We don't want to. Chiropractic is very gentle. We don't want to really treat somebody that cannot stand to be touched, if they're kind of really symptomatic. You want to kind of hold off for a little bit and then maybe go and get checked and get your spine realigned. Of course, if you have a fracture, then we don't do it. You have to go to a medical route and make sure that's healed. Just yesterday in my office in Aiken, I had a lady as a new patient, and I could not adjust her. She had issues. She was hit by a horse, not once, but twice. And, over some time. And she said the last time that happened wasn't that long ago, and she ended up in a hospital. She was knocked out, and she came in, her spine's all crooked, and she can't even lay down on one of my treatment tables. And I said to her, well, I can't treat you if you can't lay down. So I found her a orthopedic doctor. So she's going to go to orthopedic doctor first and get whatever she needs to, feel comfortable. And then when she's ready, she'll come back. And her spine is all crooked. I can definitely realign it, but it doesn't help me if she can't even, lay down on a chiropractic table. They're all padded and comfortable, but if you can't do it, So anyway, so we work with other professionals all the time, and that's why we do that. There's a lot of cross work in that sense. But yeah, it should be good to get checked, but you first need to be capable and able to to go. So I would say if you're real symptomatic, you might want to go the medical route first to make sure that heals, but then come see us afterwards.
I like how you say that, Dr. Dan, because there's no prescription or there's no medicine that you can take to correct misalignments, or restore your mobility. So it would be good to get with a professional chiropractor for treatment,
exactly.
to recover from falls, even vehicle accidents and things of that nature if you have a misalignment.
And also, you did my alignment. I had alluded to you that I fell. My brother dropped me on my back when I was around about 6 years old.
Yeah.
And so you said old injuries, can kind of show up when you get older.
Yeah, so it's very eye-opening. This is why we have digital X-rays in my office in Aiken, where if they have X-rays they want to bring to us or MRI or something like that, I can look at that's recent. Yeah, I'll look at it, but a lot of people don't. So we take our own X-rays, and it doesn't take a lot. If somebody has a lower back issue, all we need to take is two views, front to back and side to side, because you're trying to, transfer a three-dimensional image into two dimensions, so you don't want to miss anything. So we look at it, and it's always an eye-opener because, the lady I was just mentioning that was hit by a horse, she has a pretty big crook in her spine. That's called scoliosis, and we can definitely help her with that, but she had no clue she had it. And so, when I took the X-ray, she was stunned because she went to medical route before, and she says, yeah, they took X-rays, but they never told me anything about this. So, you can see it for yourself. So, those are the kind of things that, so the reason we take X-rays in chiropractic office or in my office, so I speak for myself, just want to make sure I don't really speak for the whole chiropractic community. I'm not a president of anything, but I speak for my own office and the way I was trained. So the reason why I do X-rays is really twofold. Number one is to rule out pathology. We want to make sure that there's nothing underlying there that will prohibit us from providing chiropractic care. So it's safe that we do what we do. And, that happens once in a while. We do see things that will prohibit me from, treating somebody like, somebody might have cancer and they don't know about it, and you see a tumor there, and that could be causing referred pain into the spine. Well, that's not going to respond to us. They got to go to a different provider. So, things like that nature, we want to make sure we rule up, pathology to begin with. That's number one. And number two, we can actually see which way or which direction the bones in the spine called vertebrae have misaligned, so we can, do the appropriate treatment. We come out with, we're very detailed in chiropractic. We come out with what we call listings. The vertebrae can list to one side, and we actually write that down so we know what we're correcting, why we're correcting, and what direction that needs to go, and things of that nature. So a picture is very important. Now, we also do other tests. We have a lot of tests we do just to kind of make sure we know what we're doing. I just want to point out, we do really good exams, very detailed exams, that I just kind of recently found this out, and I'm going to take advantage of this. Chiropractors are allowed, at least in the state of South Carolina, it might be different in other states, but in South Carolina, we're allowed to do DOT exams, DOT physicals, for truck drivers, bus drivers, professional drivers. And I had a patient just yesterday came to my office. He's a professional truck driver. He says, man, if you do that, I'll just, come to you. There's nobody in Aiken that does it. There might be, I don't know, but I looked it up and hey, I'm going to do that. I'm going to provide this service as well. So we have to take a course where you get educated what's involved and what kind of exam you got to do. But we already know that. That's what we normally do. And then once I do that course, I would then go and take a test that's administered. That's by the government. And then if you pass that test, then you get issued your provider number. And then they put you on this DOT Physicals, website where people like the truck drivers can, look up and see where the nearest DOT physical physicians are so they can go and get it done. And I think that's great. And when I went on their website, I didn't see anybody listed in Aiken,
And
There's
that's the
something
thing.
like,
That's the
yeah.
thing, Dr. Dan. We have a lot of truck drivers in the CSRA area.
A
So
lot.
So, I mean, that could be a whole new section of my business that I really didn't think about before. But
Absolutely.
I mean, why not? Why not do that? And he also told me, I said, how much do you pay for this? His company pays for it. So he says, what you got to do once I get my, provider number, I can contact his trucking company, and then they will send me the truck drivers and contract with me in a way. They don't really sign a contract with me or anything, but they will send them to me, and they'll pay me. The company will pay me to do exams because it's in their interest to have these drivers, working properly and not skip out. So the patient I mentioned, that's a truck driver, he has to do this exam every year, once a year. Some people are maybe once every 2 years, but it's really no less frequent than once every 2 years. So all the professional truck drivers you see on the roads, maybe bus drivers and all that stuff, they have to do this thing regularly to make sure nothing bad happens to them while they're operating that equipment. So I think that's a good idea, and we're allowed to do that. So we're gonna go ahead and do it in my office, and as soon as I do it, I'll put up signs, put it on my website because why not? That's another service that we can offer.
Right.
definitely. I tell you,
So
that's
that's kind of
opening
cool.
up a whole nother door. And like you say, you see
hmm
a need for the community, and now, you feel that need, by
hmm
going into that area of DOT chiropractic care, which is so good.
Yeah.
So, Dr. Dan, as we're coming to a close, I want you to go ahead and talk as long as you want, right, about anything else that you wanted to talk about on this morning that we didn't hit. Okay.
I was just trying to during the winter times just kind of mention a little bit about why would you go to a chiropractor? What can chiropractic do for you in the winter time? Well, one of them is joint pain relief. We can correct the spine, adjust the spine, protect the pressure of the nerves. And the reason why people actually get more achy in the winter time, as it gets colder outside, the fluid within our joints, which is called synovial fluid, gets thicker and it doesn't flow as good, and it can actually expand a little bit and cause pressure against these mechanoreceptors for pain, and we will feel achy. So your joints can become stiff and painful to operate. Also your muscles can be contracted, and they might be kind of tighter and more in spasm and things like that nature. So it's good to get chiropractic adjustment because you will keep your muscles and joints loose and flexible. You can also reduce pain caused by cold weather. Another thing I was going to mention, then I'll go into closing, but cold and flu prevention, as we know, that's more prevalent in the winter months. Well, when you get adjusted, the spine, the purpose of the spine is to protect and enclose the spinal cord, and those are all nerves in there. So the nervous system controls and coordinates the function of every living cell in the body. So it controls the function of immune system as well. So if you are properly adjusted and your nervous system is functioning optimally, you are going to be less you're going to have less potential to develop some diseases because your immune system will fight it, and that's just what happens. So I can talk about a lot more, but I don't want to take too much of your time. But
No,
that's in a nutshell.
You good.
you're good. That's why I said you take as much time as you feel you need. That was a very good nugget, though, that you just threw out there about the synovial fluids and how it gets
Yes.
thicker and expands in the wintertime.
And and that's what people say, oh, this cold outside, joints are aching. Well, now we know the explanation why
It's true.
that, so we can
That
let
is-
people know, hey guys, guess what? It's because
Yes.
the synovial fluid thickens
Yes.
as it gets
And expands.
colder and it expands. So
Wow.
you experience more joint
Mhm.
ache and bone ache. So thank you.
It's true. And we all just, we have, mechanisms in our body, but our body is designed to heal itself. We were not
Yeah.
designed, we were not designed imperfect. If you want to talk about a little philosophy there, God made us perfect in His image and all that. Gave us everything we need to survive. So
Right.
God didn't say, hey, take this pill to be healthy. It didn't design us that way.
Come on, Dr.
So
Dan. Speak the word.
but it's true. So we get all of it. So the reason why things get stuck sometimes is we just don't treat the body the right way. So you got to think about if you're doing everything properly to, maintain your health. And like we talked before, those 5 factors of health. And are you getting enough sleep? Are you getting enough nutrition? Are you getting enough movement? Do you take care of your nervous system? And do you have a positive mental attitude? All those things really matter in the end. So, if you're deficient in one or more of those areas, some bad things are going to happen. So you have to kind of look into it and see what you got to do. And, getting adjusted and getting your spine checked on a regular basis should be part of your routine. And that regular basis really depends on the person. I mean, it's not the same for everybody. Sometimes people say, well, how often should I come? Well, that's a difficult question because it depends on them, what stresses they have, how hard do they work, what kind of jobs they have, are they stressed out with the kids, all that stuff kind of matters. So, I got people that like to come once a week, once every 2 weeks. I got people that come every month, and some people come every 2 or 3 months. I mean, it just depends on their level. None of those things are right or wrong. It just depends what works for that particular person. That is part of
There
their
you
whole
go.
wellness, wellness care,
Yeah.
which I like to promote, But before you
Absolutely.
before you get to wellness, if you have an issue, like you mentioned, people falling or having car accidents, God forbid, or things of that nature, you got to fix that first. You got to get a relief care. You got to let the body, heal, and then you can maintain it. But it's a lot easier and less expensive to maintain something than it is to actually correct it at the first time. So I would say once you're in a good shape, hey, keep it going. It's so much easier to maintain it.
That's so
Yeah,
good, Dr. Dan.
absolutely. And
Yeah.
just make adjustments if you need to
Yeah.
make necessary adjustments that you need to make, change whatever you need to change, tweak whatever you need to tweak, and just keep moving, keep going, keep moving.
Right. And
Yeah.
Dr. Dan, you make it easy for people to do that with your Power Wellness program. Talk to us a little bit about that before we
Yeah, and I do that on purpose so people can afford to keep coming. And who knows what the economy is going to do? But I already had some people ask me because it's a new year, am I going to raise prices? I said no, I'm going to keep it the way it is. It seems to work, and let's not go there yet. But it's $79 for 4 visits, so that's just under $20 a visit. If somebody needs it, up to 4 times a month, that's what that is. If they want to come less often, then there's a different structure for that as well. So it's just month to month. There's no contract or anything. They're just paying to go, and if they need to, skip around a little bit and come back, that's up to them. I got patients that come to Aiken for a certain time of the year, and then they go away somewhere with the horses, then they come back. I mean, it's okay. I'm flexible for all that stuff. I just want to make sure we provide a proper care to people. But yeah, we have the Power Wellness program. You can read about it on our website, aikenchiropractic.com.
Awesome, awesome, awesome. Go ahead and give us your point of contact information. Oh, you just did that.
Yeah.
aikenchiropractic.com.
Yeah, don't call us on the phone, 803-641-9191. It's an easy number to remember. But I've been getting more and more people fill up the form on our website to contact us. Every day somebody does that, and I give it to my staff. It's kind of new to me because if it was me, I would just call. But, people they rather fill in the form. And that's fine, as long as they work. Because, what I'll do then, I will give that information to my staff as soon as possible. And they'll call them either the same day or the next day. And we'll see what the problem is or what we can help them with and make an appointment for them. But, that's 2 ways. So 803-641-9191 or aikenchiropractic.com.
Awesome,
All right. So we're
awesome.
looking forward to partnering with you and
Oh, yeah.
getting this information out to people. If we have to come to Aiken again, start back coming and doing live videos, we would do that. So
Ooh,
let
that's
us know.
exciting. Try to mix it up. Try to make it interesting.
Yeah,
Yeah.
absolutely. And I love doing things. I'm spontaneous, so I love doing things different.
Me
And
too.
yeah,
I'm a Sagittarius. I like spontaneity. I just I'm always excited about something new. Yeah, as you
yeah.
can tell, I changed the room. I'm doing the same from last one. I'm like, let's do something different in the background.
I know, right?
I gotta move things around a little bit. Yeah, it's you gotta
So
change
Dr.
things
Dan,
somewhat.
yeah. So we're expecting a large crowd doing the women on the wellness. We got great
Cool.
response from people. The doctors are excited, and so we're very excited. So we thank you for
Yeah.
being a part of it. So thank you.
Yes.
Yeah, we
Yes.
get
I'll
to see
definitely
you
be there.
next.
Yes. Well, have a good one, guys.
All right,
All right.
Dr.
All right.
Dan.
You
We'll
have a
see you
great
next
week.
month.
Stay warm.
Absolutely.
All right. I'll see you later.
Bye.
Bye bye.
All right, y'all. Dr. Dan Jolich of Aiken Chiropractic. I tell you, a wealth of knowledge in a lot of different areas. And I tell you, I always
Yes.
learn something from him
I
every
know.
time he's
This
on the show.
the calcium,
Yeah,
the
yeah,
citrate, and the carbonate.
yeah,
That's people
yeah.
need to know that. So when people you
So
going
important.
out buying supplements, please know what you're getting.
Yeah, yeah. And ask your
Self
doctor. Make sure you ask your doctor.
Absolutely.
Mhm,
Self educate yourself,
mhm.
So if not only ask your doctor, do your own research, go
Mhm.
through Mayo Clinic, Hopkins,
Right.
all these different places, do your research and look at this stuff. And that's why it's so important, coach,
Most definitely. Very
to
important.
self educate yourself. Now, don't just go out there, but then once you get the information,
Confirm it.
go
Yeah,
go
with
ahead and
professionals.
confirm it
Mhm.
through professionals and say, oh, wow. So, yes, absolutely. Go under evidence based um, sources so
Mhm.
you can get this information. So, the information is out there. We just have to make sure we get the right information, but just don't just take anything somebody tell you to take or drink anything that somebody tell you to drink because everybody body is different and how they respond to different stuff. So,
Most definitely.
that is absolutely I did not know that about the
Yeah,
eggshells.
that's good. That's good information. So, and that's why
Yes,
we bring them on the show so that we can bring good, relevant information to you so
it
you can be
pertains to
better
your health and well-being.
as it pertains to your health and well-being. Listen, we want you guys to go ahead and register for WOW Women on and Wellness 2024 is happening
Absolutely.
in Aiken.
Registration is going fast, coach.
It's happening in Aiken on February the 10th on Saturday. We want you to go ahead and register. You can go to womenowningwellness.com. I'll say that again,
WW.
womenowningwellness.com. All right, make sure that if you're going to register, go ahead and register. Slots are moving fast. You don't want to miss out on it. Okay, we got less than about 25 days before the event starts. Okay, so we want to see you there. Visit www.womenowningwellness.com.
Okay, guys, thank you so much, guys, for listening to Help Matters here, guys. Remember, we're here to help you to be the best you, to become the best you, to be the best you that you can be. We always like to leave you with 3 John 2. I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you have a healthy day. Stay warm. Make sure you bring your plants in, your animals in, if you have
It's gonna
animals,
get cold.
guys, because it's getting chill, bone cold, that Arctic cold. So be safe out there, guys. If you don't have to be out there on the road, don't be out there. But guys, get in your comfort of your home and just stay warm. We love you
Well,
guys
this is a pre-recording, so it's going to be cold this week.
this week.
It may not be cold right now, Saturday, as this is being broadcasted.
Yes. So, guys, we'll talk to you guys later. Be blessed.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Help matters to me.
Come on, get up. Cause you tune into the station for your morning motivation to get your education for your health and your spiritual need.
Help matters to me.
Yeah, strong will to empower the people, to promote the peace, no positive attitudes, behavior that's a lifelong dream goal.
Help matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Help matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Help